Today we're going to talk you through the best exercises if you have a bunion. I'm James, a knee, foot and ankle specialist. We're going to take you through a step-by-step guide of how to perform exercises if you've got a bunion to help decrease pain and improve function. If you listen to the audio carefully during the demonstrations, I'll talk you through how to move on to each stage. And please keep in mind this is for educational purposes only and it shouldn't substitute medical advice. The big toe has an independent tendon to the rest of the toes, so you should be able to use it independent of those. Practice lifting your big toe up and down without using your lesser toes. Then a second exercise is called yoga toes, which is practicing spreading your toes apart from your big toe. So this strengthens the smaller muscles between your lesser toes. Then a difficult but really important exercise is to practice adducting your big toe, so bringing it in towards your midline, and that strengthens the muscle on the inside of your foot, which helps control your big toe and stop it going inwards. Then it's important to strengthen the arch moving across from the big toe to the lesser toes. Practice raising that arch without scrunching your toes too much. Following this, try to raise the arch of your foot by bringing your big toe knuckle towards the heel. Try not to scrunch your toes and focus on raising the arch as high as you can. Then it's important to strengthen the muscle of the big toe on the opposite side, the flexor hallucis longus. To do so, we need to practice the correct movement of the foot, so point the foot down, followed by the big toe up, and then back down again. This is a really important muscle for strengthening the big toe joint. You can progress this exercise by standing on the edge of a step. Place the band around your big toe and lift your toe up and down against the resistance of the band. Then you can progress this exercise by lifting one foot off the floor. You can use the wall for balance initially if you like, and this works the extrinsic and intrinsic stabilizers of the arch of your foot, and then try and bring your big toe up and down. To progress this exercise further, you can take your hand away from the wall to try and stabilize on one foot, which can be quite difficult. Then, as a result of having a painful big toe joint, which is normally associated with a bunion, we often don't push through fully during the gait cycle. This leads to tightening of our calf muscle, so stretching our calf with our back leg straight is important. And then this can be followed by a soleus stretch, which is the same position with the back knee bent. We normally hold for 45 seconds. Then it's important to strengthen your calf muscles. So one way to do this is by doing double leg calf raises, so lifting slowly up and down, trying to get as high as you can, up for 2 seconds, down for 2 seconds, and we normally recommend between 22 to 25 repetitions. And then you can progress this exercise by moving from a double leg onto a single leg. So up on the affected leg, 2 seconds up and 2 seconds down. If this is uncomfortable on your big toe joint, you can practice it on a cushion or a pillow using the wall for support, and that should decrease the amount of force that goes through the joint. All repetitions and frequencies are in the description below. If you found the video helpful, please keep in mind we've got other videos on the best bunion correctors and the best shoes for bunions. If you have any questions on the exercise in the video, please leave them in the comment section, and if you found the video helpful, please like and subscribe to the channel.